Welcome to Kinesiology 4330, Family Health. We're going to be discussing end-of-life issues and death, including Chapter 14 from our text, Sociology of the Family on Aging and Families. So covering gerontology is the scientific study of aging and growing old. Social gerontology is the non-physical and social aspects of aging. Aging is different today as our lifespans increase. I once ran a 10K about 30 years ago, and the categories for medal winners were stopped at 65 and over, which even at that time, there were people who were well into their 80s who were running competitively, but were 2 decades older than those in their category, which was obviously unfair and did not represent their activity level. So as we can see, there's various categories of old now, and gerontology is a separate and distinctive discipline within many different fields, including financial planning, medicine, social work, and psychology. Family gerontology shows the impact that aging has on the family. Terms such as being in the sandwich generation, where you are coming to a time in life, typically in middle age, where you are now caring for your children at home and now beginning to have to monitor the health, well-being, and living conditions of your aging parents. In many cases, the aging parents will either need to change their living situation into an assisted living situation or move in with their adult offspring who are now able to take care of them. Filial piety is a term that's discussed in our text. It's the value, respect, and reverence of one's elderly, which is often accompanied by caregiving and support of the elderly. This is common in cultures outside the United States, and we see them as our society becomes much more diverse and multi-generations of families are living under the same roof. Some of the social theories of aging are also covered in our text, such as the continuity theory, which claims that older adults maintain patterns in their later years that they had in their younger years. For instance, Grandpa here, who still refuses to wear his seatbelt in his car. The activity theory claims that the elderly benefit from high levels of activity, especially meaningful activities that help to reduce and replace lost life roles after retirement. Part-time jobs and serving in a volunteer capacity are great ways to stay stimulated for the elderly and to give back to the community. Grandparents. There are different types of grandparenting, and we're going to maybe take a look at this if you see in the movie Parental Guidance, where Billy Crystal and Bette Midler play the role of assistant grandparents. They can take on the menial but necessary tasks of parenthood, including getting the kids to school, practices, and appointments. This is often the case with both parents working full-time or having jobs that involve travel, or single-parent homes with working mothers. Disneyland grandparents. These grandparents provide certain entertainment options that is missing for the children's not yet established parents. Grandchildren come to have high expectations of indulgence when spending time with these grandparents who now have some disposable income in the form of their retirement and pensions to be able to dote on their grandchildren. The parental substitute grandparent is the one who lives at home, in the home with the grandchild, or the grandchild lives in the grandparent's home. The United States Census Bureau estimates that over 6 million grandparents do have their grandchildren living in their home. Our most famous parental substitute grandparents were President Obama's grandparents. The stability that they provided him and the path that they placed him on, without question, played a hand in who he is today and who he became from a young man to being able to become our 44th president. I doubt very seriously if his success and position today would have been realized without their intervention and influence. Distant grandparent relatives. These are grandparents that visit at times and live at a geographic or emotional distance from their grandchildren. They typically can't or will not have a close relationship with the grandchildren. Telephones and the internet allow these grandparents to consult with the parents and be intermittently involved with the lives of their children and grandchildren. But many grandchildren experiencing this type of grandparenting often report a disconnect to these grandparents. Our text also talks about the disengagement theory. This was the first formal aging theory that somewhat fell short of credibility because the scientific data did not support its assumptions. It claims that as elderly people realize the inevitability of death and begin to systematically disengage from their previous youthful roles, society simultaneously prepares the pre-elderly and elderly to disengage from their roles as well. The elderly, however, are much too diverse, and there are too many factors that contribute to a health and mental decline and can contribute to this theory. Certainly, individuals can be predisposed to this after they retire and are less involved, but this is not by any means a given with the aging process. The modernization theory. Even though this theory is not as well established and is somewhat controversial, it has made a place in science for understanding how large-scale social forces have impacted the individual and collective lives of the elderly. In our modern society, the economy has grown to a state that has created new levels of prosperity for most. The new technologies have outpaced the ability of the elderly sometimes to understand and use them, and the elderly are living much longer and are not essential to the economic survival of the family, as was the case for the millennia. Modernization can help us to understand why the elderly have become stigmatized and devalued over the last century. As we see now, the elderly and the aging are a demographic group or a cohort of people that share a similar statistical trait. Now, just because you're retirement age doesn't mean that you're simply old. There are categories of old, and Chapter 14 discusses these divisions of aging. Ages 65 to 74 years old are considered young old, middle old are considered from 75 to 84 years old, and old or 85 plus years old. Baby boomers are the demographic group of people born right after World War II and continuing into 1964. It's a period of prosperity in American culture that saw the beginnings of large suburban housing developments, such as we see here in Levittown, Pennsylvania, that became large housing developments here on the West Coast as well. Aging can bring on emotional, intellectual, social, and spiritual changes as our activity and sometimes our engaging in life sometimes becomes known as senescence. There are natural sequences in our life course that an average person would be expected to experience as they move through life. Many elderly do have trouble keeping up with the technology and the types of communication that the younger generations tend to utilize. Voicemails and emails are not as effective in communication, and the all-important voice, on the other hand, and on the other end of the line, remains very important and an essential part of the family and business communication. The U.S. life expectancy today is about 80 for females and 75 for males. Worldwide, it is about 70 for females and 66 for males. Life expectancies have increased dramatically over the last 50 years in Western nations of Canada, United States, Australia, Japan, and Western Europe. Overall, men and women can expect to live much longer than they did in the 1940s through the 1990s. As far as our healthcare system, there are at least two government-based systems that have traditionally cared for the economically disadvantaged, medically and mentally disabled, and in many cases dependents of those who are. The Affordable Care Act has had an impact on these plans, and in the Medicare plan, various private insurers like Blue Cross, Sutter Health, and Kaiser are all vying for these patients who sign over their Medicare benefits and buy a supplemental medical plan. Packages that provide for long-term health, caregiving, and prescription coverage for conditions that are prevalent as we age. A form of discrimination is known as ageism. It's a unique form of bias, and one may be prejudiced against another racial group, cultural group, or ethnic group, or even a religious group, while never being at risk of becoming a member of that group. Ironically, ageist people are aging right now and will be until the day they die. They are essentially biased against their own future status. Again, healthcare plans become an important purchase in life. The fact remains that for many people, 80% of the healthcare dollars you spend in your life will be spent in the last 9 months of your life. Today, numerous healthcare companies like Blue Cross, Anthem, Kaiser Permanente, and Secure Horizons are competing for the business of the elderly population, and it is important to choose a plan that best meets the need of your health condition and not to overspend on things that you won't need in the foreseeable future. The future in healthcare will put much more onus and responsibility on the consumer for their own healthcare. In-personal doctor visits will be replaced by online discussions and telemedicine to triage or generally troubleshoot medical conditions before they progress to worse situations that could require hospitalization. Many over-the-counter medications and prescription medications have generic alternatives that are significantly less costly and equally effective to the prescription medications. When our medications that can't be neglected take up a significant amount of our monthly budget, then you have to get practical and smart with your finances very quickly. So an advance directive is any statement made by a competent person about his or her choices for medical treatment should they become unable to make such decisions and communicate them in the future. A healthcare proxy is a type of advance directive that allows an individual to appoint another person as an agent in making healthcare decisions in the event that he or she becomes unable to participate in treatment decisions. This is also known as durable power of attorney for healthcare. A surrogate is the agent or substitute decision maker appointed by a person to act on his or her behalf by means of a healthcare proxy. So we will now watch a film on advanced medical directives and describing how they work.
Written instructions that let people know the kind of care you want if you are seriously ill or dying are called advance directives. These are official documents that state your wishes for medical care in an emergency and at the end of life. These include a healthcare power of attorney, a living will, a DNR or do not resuscitate order, and a POST or physician orders for life-sustaining treatment.
A durable power of attorney for healthcare is a legal document in which you name someone your healthcare proxy. That is the person who would make healthcare decisions for you in the event that you could not make them for yourself. Durable means it remains in effect even if you become unable to make decisions. A living will records your end-of-life care wishes. It also spells out what life-sustaining treatment you do or do not want if you are in the last stage of a fatal illness or permanently unconscious. You may wish to meet with your healthcare provider to discuss treatment options for a variety of medical situations before preparing a living will. A do not resuscitate or DNR order tells healthcare providers not to perform cardiopulmonary resuscitation, also known as CPR, or other life support procedures if your heart stops or if you stop breathing. A DNR order is signed by a healthcare provider and put in your medical chart. A new alternative to the DNR is on the horizon at some hospitals. Called an AND, or Allow Natural Death Order, it ensures that only comfort measures designed to provide excellent control of pain and other symptoms are taken. A POST form, which stands for Physician Orders for Life-Sustaining Treatment, is created specifically for patients with serious advanced illness. A POST form provides standing, actionable medical orders concerning end-of-life care. Patients can create a POST by discussing the treatment options with a healthcare professional, who then signs the form. Research shows that patients using a POST form are more likely to have their end-of-life care wishes honored.
The time to plan for end-of-life care is before you need it.
It is best to create an advance directive while you are still relatively healthy. Some people hesitate because they aren't sure what they want or they worry about changing their mind. The advance directive doesn't take away your authority to make healthcare decisions while you are able, and you can change an advance directive at any time.
Planning for death. When someone dies without a will, it is called intestate. The wealth gets distributed. The testator is the person making the will, and the estate is the money, property, and other possessions of the deceased. A living trust is a legal action that puts a person's assets into an Internal Revenue Service classification that shelters the assets from taxes and protects the person's allocation of assets from the public eye. Here we see an example of the components of a will. It should be notarized and witnessed, and enlisting the help of an accountant or an attorney is a good idea depending upon your financial holdings, assets, and property, and how you would like to see them distributed among your family and other beneficiaries. Thanatology is the scientific study of death and dying, and grief is the feeling of loss we experience after death, disappointment, or tragedy. And here we see Elizabeth Kubler-Ross's 7 stages of grief. In consideration of death, lifespan is long enough to allow reproduction and lineage of our species. It challenges our emotions and intellectual security. Religion often plays a major role in shaping our attitudes and behavior about death and perhaps the afterlife, and we know that everything alive does eventually die. In terms of clinical death in humans, it's characterized by the absence of a heartbeat, respiration, circulation, and the combination of heartbeat and respiration. There is a set of standards that go with defining death medically. Culturally, how we view death in the United States, we are an extremely diverse culture in the United States of America, but we are very Western in our views of aging and dying. Let's face it, we spend more time on anti-aging remedies than any other country or society, so it's no wonder we do anything to avoid the mention or planning of death. The fact is, the more we talk about it and plan, the less anxious about the thought of death we'll become. In terms of learning about death and understanding death as we age, we need to mature, and there are 4 components according to Mark Spies. There's universality, all things must die; irreversibility, organisms that die cannot be made alive again; non-functionality, which is the cessation of all physiological functioning or signs of life; and causality, which is the biological reasons for the occurrence of death. Most never want to spend much time considering the process of dying, let alone death itself. It can cause fear and anxiety. Many seek to simply avoid the discussion altogether, but this is actually very unhealthy. Here we do have Elizabeth Kubler-Ross's stages of grief. Grief is the feeling of loss we experience after a death, disappointment, or tragedy. When you experience grief, you are said to be in bereavement. Bereavement is the circumstances and conditions that accompany grief. Categories that she called denial, which was pretty much a feeling of all is fine or no, this didn't happen. Anger, such as saying to yourself, why me, or I hate God for this. Bargaining, I'll be a better person if you just let this person live. Depression, all is lost, or why even try. And then there's acceptance. We'll be okay and we can get through this together. Death in other countries and cultures, such as in Mexico, there's Dia de los Muertos, which is a 2-day Mexican holiday where children and adults are honored, reflecting their belief that the dead return to earth as spirits once a year. It often coincides with All Souls Day around Halloween, and the graves are decorated with bright yellow flowers. Euthanasia is commonly discussed as it relates to end-of-life and tragic health situations that can lead to coma and brain death. For our purposes, we're going to discuss 2 different types of euthanasia, which is active and passive euthanasia described on this slide. Active euthanasia is a deliberate act intended to end another person's life and helping a patient hasten death by knowingly providing lethal drugs or other interventions called physician-assisted suicide. Passive euthanasia is withdrawing life-sustaining support such as artificial respiration. Again, this is the common situation when a family has an advance directive and the person has decided they do not want to have any life-sustaining measures to keep them alive. There are many decisions to consider before you're forced to make a decision or a family member gets involved who may or may not know what your wishes are for care, such as hospice programs, palliative care, access to sophisticated medical technologies. Would you like to spend your last days at home or cared for by relatives or friends? Okay. Deciding to prolong life or hasten death. Would you want aggressive treatment to address your health condition if you were in a persistent vegetative state, which is a condition of profound unconsciousness with no reasonable hope for improvement? There have been several landmark court cases that gave legal precedent to these end-of-life issues. This is the situation where somebody ends up in the hospital and falls into a coma that they don't seem to have any means of getting out of, and determining what the end-of-life wishes would have been for the person who is in the hospital bed. So as we age, we can grow old gracefully, where our bodies both physically and mentally slowly decline and deteriorate, or we may be faced with a rapid decline, such as a terminal illness such as Lou Gehrig's disease or cancer. The trajectory in death can be very sharp or it can be very gradual. Coming to terms with death, we get confronted with emotions and thoughts that relate to the immediate loss, but also to our own mortality. It teaches us that relationships are more important than things, as we learned about in the film Consider the Conversation, and allows ourselves to make room for death. And denying death, as it turns out, results in denying life. There is no one right way to live or die of a life-threatening illness. Doctors treat diseases and people suffer from illnesses. There are concerns with the cost of medical care, the loss of income, the repeated and lengthy hospitalizations, and of course the physical pain that the person is going through. One major area that can be addressed is becoming an organ donor in the event that you die and your organs can be used as a valuable resource for others who might benefit from them who need a transplant. Having a uniform donor card is good. This can be done online. It can also be done through your driver's license to let the proper authorities know that your organs can be used. Now we're going to watch a film called Ray of Hope about the organ donation process. A funeral or memorial service. There are many considerations socially, culturally, religious, psychological, and between each person. It's a very personal decision of what you do. Arranging a service in terms of the choice of the last rites, traditional funeral service, or a simple memorial service, it can cost between $5,000 and $7,000 or more. In terms of the tasks of coping, Elizabeth Kubler-Ross and Charles Cord discussed the psychological, physical, and social and spiritual aspects of dying. Kubler-Ross focuses on the 5 psychological stages, including denial, anger, bargaining, depression, and acceptance. Cord's primary dimensions in coping with dying involve physical, psychological, social, and spiritual. In terms of coping with loss, there is the experience of grief and reactions to loss. The tasks of mourning, which include accepting the reality of the loss, working through the pain and the grief, adjusting to a changed environment, and emotionally relocating the deceased and moving on. Again, there is no universally correct way to help a person through the grieving process, but there are some basic guidelines to follow when supporting a person, including listening, refraining from making judgments about right or wrong feelings, even if someone feels a sense of unnecessary or unsolicited guilt. Unconditional love and support is critical during this time. Children bring up a completely different dynamic, and young children will always have difficulty understanding the reality and finality of death. Some may dwell in grief for extended periods, and others may move on rather quickly. Again, going back to the film that we watched, Consider the Conversation talks about palliative care and focuses on pain management and comfort of the patients who know that they are in their last stages of their life. Hospice care is a comprehensive program that offers a set of services designed to support terminally ill patients and their families. So as you review this information, just be sure to make sure that you're checking your university email on a daily basis for any important announcements. Log on to the Family Health Blackboard page on a daily basis throughout the semester to check for your assignment guidelines, calendaring your due dates, and checking for your updated grades scores. And be sure to read your assigned text readings from the Sociology of Family textbook by Hammond, Cheney, and Piercy. It's available online at the link listed on this slide. Thank you very much.